Okay, everybody, welcome to this special edition of Coaching Conversations. So as many of you know me as an opera singer, as a performer. That has been my primary trade. And also a leadership and life coach. But I'm here today as a singer who is curious about how this pandemic will affect the theater industry, the performance industry going forward. And so to assuage some of this curiosity, I have invited the wonderful Dr. Taison Bell to join us today to answer some questions, to give us some insights, on really how we can move forward as a singing community during this time. So y'all, I want to, after I put my hoop back in, I want to give you all, y'all got to excuse me, I'm still me.
This real
it's real life. Hoops come out in real life, okay? So I want to just give you all some context for who Dr. Taison Bell is. Okay, so I'm gonna read a little bit of his bio. So don't you hate this when people read your bio and you see it right there? Just bask in all that you have done and been. Dr. Bell is the co-founder and co-CEO of Owl Peak Labs and assistant professor of medicine at the University of Virginia, where he is director of the medical intensive care unit. And you'll notice that Dr. Bell is in full uniform because he is actually on call in the ICU. So we thank you for taking this time to come be with us. Dr. Bell completed his medical degree at Columbia University and trained in internal medicine at Massachusetts General Hospital, where he was a chief resident. He subsequently completed an infectious disease fellowship at the combined Massachusetts General and Brigham and Women's Hospital program, followed by a critical care fellowship at the National Institutes of Health. Dr. Bell received his BA and MBA from the University of Virginia. So that's just, some of Dr. Bell's, accolades. But, I actually met Taison through his beautiful wife, Kristen. She and I did a show together last summer, and I met the family, and they have become my family in Virginia. And I have known Dr. Bell to be extremely intelligent and insightful. I have known him to be authentic and sincere, and especially, in conversations that have been happening lately in terms of, especially with the Black community's comfort and confidence in the medical industry, given some historical malpractices. I think it is very profound that Dr. Bell is present and is a trusted voice in this conversation around COVID-19, because we don't know what's happening. And I have seen Dr. Bell really on the forefront of these conversations as an infectious diseases expert, just really seeking, having these conversations, leading the charge to find resolutions. And, I started to see the lives pop up on my feed. You said there's been about 12 lives that you all have done?
Yeah, 12.
He does a live every Monday night at 7 p.m. Eastern Standard Time with Dr. Cameron Webb on Dr. Webb's Facebook page, where you all go live and just really talk about the state of affairs and assuage the concerns of, the community in regards to this pandemic. So I'll just say that my intention for today is to really explore ways that we can move forward as a singing community, and to really start to be creative about that. I mentioned to you that we've seen a lot of industries starting to find ways to go back to work in a mindful way that minimizes exposure, and we see that as challenging with singing. So I brought you on here because I'm like, people got some questions, and and I just want to hear what you got to say. So again, I want to thank you for coming through. That was a long-winded introduction and a lot of talking on my end, but there will be less of that going forward. So Dr. Bell, my first question for you is, what is your intention for being here and talking with us today?
Thank you for having me, first of all. I've always felt that the problem with COVID-19 has been that it's a medical pandemic, and that there's a sense that there's a virus that's spreading, but it's also an information pandemic. And just like the virus itself, misinformation can spread rapidly, and it can cause people to make the wrong decisions and ultimately lead to more people getting sick and more people dying. So as best as I can, when I started doing this with Dr. Webb, our intention was to make sure that we spread accurate information as much as we can. There's always going to be things I don't know. And, when we're faced against our limit of our knowledge, we acknowledge that and say that we're not perfect. We don't have the answers. But what we can share is what we've learned from our experience with the virus, taking care of patients, from the studies that have come out, and making it something that is digestible and gives you the information that you need to make a good decision for yourself, your career, and your family. So I explain to my patients oftentimes that I'm the information translator in chief. That you will get lots of different inputs from many different areas. So you're on your Twitter feeds and Facebook, and you're hearing the news and reading articles and conversations with friends, and maybe some of you have connections with medical professionals. So you're getting all this information about what you should be doing. But ultimately, my job in the intensive care unit is to take all of those inputs and put it into a digestible package that someone can understand so that they can make a good decision about what they want to do going forward. And that's my intention here today, to give as accurate information as I can to help answer some questions. Knowing you, Jamie, there are going to be some questions that I may not know the answers to, or some that are pretty deep. But when we cross that limit, I'll acknowledge that. This is a difficult topic, but it doesn't mean that we shouldn't try to at least give the best information that we can.
I appreciate that willingness to acknowledge your limits, and I'm not gonna set out to stomp you, but and as Dr. Bell said, he is here to answer some questions. So if I'm gonna be keeping an eye on my phone in the comment section. So if you have questions that arise for you, then let us know, and we'll get to them. Well, I said I'm gonna keep an eye on the comment section, but I'm not seeing it coming up. Okay, there we go. Let me turn the volume down on that. So information translator. Where do we stand right now in terms of this pandemic? As you mentioned, we've got information coming from many sources, some more credible than others. And we are really being challenged to sift through. And so I asked you this question as, like I said, I have a trust of you as an expert and informed person in this field. So from your perspective in general, where do we stand in this pandemic? And answer that any which angle you will.
Sure. So I'll talk from the national level. The U.S. was the hardest hit country so far for COVID-19. Most cases, most deaths, and still cases ongoing. when we started with this back in, it started worldwide in late November, early December. March and April is when we were starting to get into the throes of it. We were in the midst of a case count that was going kind of like this. If you looked at a graph of the case count, it was going up and up and up. We saw the stories of New York City and Seattle, Washington, and other areas that were hit particularly hard. New Orleans and Louisiana was another place that was hit very hard. And this is when we were learning about social distancing and the importance of staying 6 feet apart, washing your hands, staying home if you're sick, isolating yourself if you had symptoms or you tested positive. So a lot of that sort of early phase of where we're just learning about what we should be doing is kind of past us. And I think most of us have a sense of what are the things that we need to do to stop the spread of coronavirus, wearing a mask, and limiting outdoor activities. We've seen that we've come against the strain of the economic downturn that is caused, and the strain of people losing jobs and not being able to provide for their families. And so in addition to the tug of the virus, there's the tug of the economy. And how did the two balance against each other when you're trying to determine what you should do on a large scale? Should you reopen the economy? Should you not? You have seen that different states have made different decisions in regard to this, some based on the evidence and facts on the ground, and some based on politics and political leanings. But we're at a phase now where we've seen our number of cases per day go down, so meaning the rate of new infections has gone down nationally. And this concept of flattening the curve has happened in our country. So instead of the graph going up, it started to come down a little bit. So we're still adding new cases per day, but the rate that they're going up has gone down. And that's certainly a good sign, shows that social distancing is working. But now we're in a little bit of a limbo phase where we've had some locales, some states that have reopened the economy, reopened businesses back up, reopened houses of worship and things like that, restaurants, et cetera. And we're in this phase where we're trying to see if we're going to see consequences of that. In addition, there have been lots of protests for the George Floyd killings, and people are doing more mass gatherings and protests because of that. And you've seen the images of tear gas and people coughing and chanting and all things that could be a high risk of spread for the virus. We're in this phase where we're going to see the consequences of these different actions across the country and get a sense of, are we seeing a new spike in cases? And if we are, is that going to lead to more hospitalizations and potentially overwhelming our healthcare system? So right now, I would say the medical community, we're in a nervous watching and waiting mode, and we're trying to see what's going to be the effect of this. It will be somewhat insightful to see how the effect of relaxing social distancing and opening up the economy, because it'll give us a sense of what to expect in the fall when we're having a debate about children coming back to school, colleges opening back up, and maybe loosening travel restrictions. Having a sense of what that might look like is something that would be useful. And then on the horizon, just to forecast ahead, how does this all end has been the major question that I've been getting, and that's going to require a vaccine. And I don't see another way to really avoid that. I don't think coronavirus is going to go away magically, like the president said. It's shown an ability to persist in the environment and transmit human to human. We expect that it would slow down in the summer and warm months, but it has shown an ability to still transmit during warmer months. And when the fall happens and winter, a lot of people expect that it'll come back. So a vaccine will be the ultimate cure, or the way that we can get protection from repeat infections or the people who have not been infected, to have a measure of protection. But until then, we're in this phase where we're relaxing some restrictions, still holding some in place, and trying to make good decisions in the midst of imperfect information.
So, and you actually spoke to something that I was curious about too, because, I remember hearing that, they're hearing about this second wave, this anticipated second wave that was supposed to come later in the year. And you spoke to how there's this anticipation that the warmer months might help to slow the spread, but that might not actually be the case. So let me see some of the questions we have going forward. So we know we've heard that transmittal, the droplets, the coughing, the talking, all of these things. You mentioned how in the protests we've seen people coughing and chanting and all of these things, how these are all agents, which is what the cause of concern is for singers. I've heard the term used for singers as super spreaders. So it's like, okay, wow, super spreaders. So could you just kind of, basic level explain to us why singing is even more of a challenge or a catalyst, I guess, for the spread?
Sure. So first thing I'll say, I love singers. I can't sing that well, but I'm in a singing musical household. My wife is a singer, and you two did a show in The Sound of Music. So one thing that I've learned is what singers have to do to tune and grow their instrument. So first, just talk from a science standpoint, how the coronavirus spreads. So it is thought to spread primarily person to person. So when people are in close contact with each other, droplets that come out of your mouth or nose can be infected with the virus, and they can spread. So they either come out of your mouth or nose, they spread directly to another person, gets onto one of their mucous membranes. These are the parts of your face that are moist. So like your eyelids, your inside your nose, your mouth. And then they can set up shop and cause infection that way. Another theory that you could, not spread it directly to a person, but cough or sneeze it, or it goes onto a surface. Someone else touches that surface, and then they touch their face, and they can get infected that way. So different ways that it can spread. There's another thought that it could kind of persist in the air, and we don't think that is the predominant way that it spreads, but that's theoretically possible. So at baseline, not even thinking about singing or running hard or even doing anything, just living your normal life, there is a potential for that to spread. And this was the whole principle behind socially distancing and trying to stay outside of that 6 feet range. That wasn't a particularly evidence-based number, but most these droplets will not make it past 6 feet range in the course of normal conversation. Now, let's talk about the specifics of singing. So having seen you, Jamie, in action, and my wife, Kristen, in action, it's something extraordinary that singers can do. They breathe deep, they project their voices, and they can, and because of that, it can cause more spread. And I don't like this term super spreaders because it makes it seem like you're doing something wrong. But from a scientific standpoint, the thought is that singers, when they're breathing down from deep within and projecting and using their instrument, that you could create more aerosolized particles. So instead of the normal size droplets, these are super small droplets because they come from deeper down. And these super small droplets aren't as affected by gravity as much, so they don't fall directly to the ground. They might persist in the atmosphere a little more than the usual droplet. So you're able to spread them a longer distance because they go with the air currents. And because you sing for an extended period of time in close contact with others, this is why you're seeing things like the study out of Washington, where there was a choir singer who infected 87% of the people around them. A similar instance in Amsterdam with a choir. Or even though people were trying to do the right things as far as not shaking hands or touching each other and trying to stay distance apart. I think the Washington case, they weren't 6 feet apart, but they maintained some distance. A lot of people got infected, and some people got sick, and some people died. So that has been the main concern, because for all intents and purposes, you are a vocal athlete, and you can do things that normal people just can't do. From the perspective of the coronavirus, it becomes easier to spread through activities like singing.
So, Ben, because when I was thinking about calling you on today, I was thinking more in terms of choral collective singing. And even just hearing you talk about this, even as a soloist, if I were, it sounds like that's the danger of even singing in front of an audience, that if I'm infected, to be able to project in such a way that is extraordinary, I guess, to the audience. So, but there are ways, right, to kind of check. Like, we've heard that it's possible to be asymptomatic and to still transmit the disease.
Mm-hmm.
From what I've seen, and I will admit, I ain't a doctor, and I'm fairly fair. I say I'm fairly ignorant on this. So, but from what I've seen, where was I going with that?
You're probably going to ask me, is it possible to spread even if you don't?
That's what I was going to. Thank you. In terms of being able to check to see if somebody is an asymptomatic carrier, really. So I want to steer the conversation to what can we do? What is possible to be able to do in this next stage? And so I've been hearing some of these conversations, and some of them have entailed, checking people's temperatures, performers' temperatures, or, choir members' temperatures before coming into the room for rehearsal, or before, going in for a show. I've been seeing pictures of different theaters showing, how they've removed lots of seating so that they can create seats between patrons. My thing is if you're asymptomatic and you check the temperature, does that, is that an accurate gauge? And what is it possible to get a truly accurate gauge of who is carrying, the virus, even if they don't have a fever, or if they don't have symptoms?
Right. That's going to be very hard, unfortunately. Luckily, most people who get coronavirus will do fine. 80% of people, so that's 8 out of 10, will have either mild or no symptoms. But that also means that there are some people who will be asymptomatic, meaning they do not have symptoms, so they feel completely fine, yet they're still able to transmit. And one of the reasons that the coronavirus has been more transmissible than influenza, which we're all familiar with, but it spreads more than influenza because there's a longer period of time where you can spread the virus even if you don't have symptoms. We even found out that after George Floyd's autopsy that he was positive for COVID-19. So he was infected with COVID. He did not. It seems like he did not have symptoms, but he still could have potentially been someone who spread disease. We don't know what phase of disease he was in, or early or middle or late course, but he was positive, and that was something that was discovered after the fact. No, he was likely asymptomatic. The problem there is that if you're asymptomatic, obviously you don't have symptoms, so you don't feel like anything is up. You will likely not have a fever because while most people who are symptomatic will have a fever, they can still have a period of where they have mild or no symptoms before that fever comes on. So just checking a fever, it might let you know if someone is symptomatic who could be transmissible, but it won't let you know about the asymptomatic person because they may not have a fever at all and not have any symptoms. So even if you design a screen where you say, ask about a fever and then ask about symptoms, there could still be people who have infection with coronavirus still pass both of those screens and make it back and go into the building. So I think in terms of there's two spaces I'm thinking about. So one are the patrons and the people who come into enclosed spaces, and the 6 feet apart, making sure that there's ample supply of hand sanitizer, make sure that people have masks on, and all of those things. are really, really good. And those will be the same as you go to other establishments. But singing in and of itself is a high risk activity. When we've seen the data that's come out of people coming together and singing, this risk of projecting aerosolized secretions is very real. So there's a different level of risk that exists on the stage compared to people that are in the audience. And it pains me to say this because I know people in the singing community aren't going to like this advice, but when I've spoken to a lot of my colleagues in infectious disease and epidemiology, singing and so things like church activities and mass performances are things that still make us nervous and will continue to make us nervous as the country reopens.
Yeah, we don't like that. And and I get it. It's been a concern. It's been a personal concern for me as well. But so just some specific questions, because you mentioned that we found posthumously that George Floyd was a carrier, and from what we haven't heard anything that says that he had any symptoms. And we've heard different conversations around herd immunity and these things, and that maybe we shouldn't be trying to avoid the virus, but just maybe do our best. What's that?
Let it wash through.
Let it wash through, or maybe just maybe we're not trying to avoid it. Maybe we're just decreasing maybe we're just going about things in a safer way. And I think that if we get to the point to where we feel as though it's essential to meet, is there, well, let me see one of the questions that I have. So one of the conversations I've been seeing in terms of ways to integrate singers back into church service, and even if you're not bringing the entire congregation back in, but if you're starting to introduce singers back into worship, even for the broadcast services, these are people, there's a risk there, right? But to decrease the risk, how far would you say that they would actually need to be from each other? Because you mentioned the initial 6 feet wasn't really based on scientific. It was just kind of like a good number to go with. Now that we're on this point with the knowledge that we have, do you have a suggestion of if we find ourselves needing to bring singers back in, what would be a good distance to mitigate some of the risk?
Sure. So 6 feet was, like I said, it wasn't based on a bunch of scientific articles that looked at spread beyond 6 feet, but generally when in the course of normal activity, so talking with each other, a cough, those droplets that can transmit coronavirus will generally not travel beyond 6 feet before they fall to the ground. So these are for normal sort of secretions that come out. Singers will have a different capability in projecting your voice and essentially exhaling with a lot of force, which is what singers do, has the potential to project those secretions and droplets and aerosols beyond that 6 feet cloud, that 6 feet cloud of protection, so to speak. So I don't know what that specific number is, only that we think in the medical community, there is potential to spread beyond that 6 feet. So I don't know personally if singers are on stage, how far apart they should be. And in addition, I talked to Kristen about this because I was like, I might have to tell Jamie some things she may not like, but I mentioned a microphone so you don't have to sing so loudly. And she said, don't talk to a classical singer about no damn microphone. Like they're not trying to hear that. Oh, my bad.
I mean, your teacher, your wife has told you correctly. We don't be doing microphones.
You don't play
But
that.
I will say, that does take me into, because we're making adjustments. Before we started the call, I told you I'm learning how to be a record producer. I won't go into that story, but that's not my area. But we're learning different softwares. We're learning new things, right?
Yeah.
In order to pivot. And so, the prideful classical singer who, prides ourselves on our technique, what I'm hearing is that very technique could be dangerous, in this time, because we have the ability to tap into these, smaller particles that can follow a completely different pattern and possibly have more of an impact. So, I'm hearing you say and asking if you would speak to that a little bit more. But I'm hearing you say that singing into a microphone rather than simply using the voice to project might provide a tool to circumvent some of the risk. Can you talk about that a little bit more?
So, and I don't do this. So I don't sing and I don't use microphones that much. But having a microphone amplifies your voice, similar to when I saw you in The Sound of Music. And that allows you to not have to project as much as you would if you were in a concert hall without any of that equipment. The force of exhalation is what is going to project those particles. So when you're able to cut down on that exhalation force, because you don't have to project as much, that would decrease the risk of the spread. It's not going to decrease the risk of spread to zero. The zero risk is if you're at home in the first place, not doing anything. That's not really practical for a lot of people. But it does lower it from that maximum risk, which is chanting and singing loudly in a group on stage with others. So it's a strategy. It's something that could be considered. That could decrease the risk. The other thing that also kind of pains me to say is that wearing a mask while you sing, I can't picture it. But I'm just talking as a scientist here. This would be a way to decrease the amount of secretions that come out of the mouth. The last thing I'll say is that you notice I have these on top of my head. So when I go into a patient's room, by hospital rules, I'm mandated to put eye protection over my eyes because the coronavirus can spread through mucous membranes in your eyes. Actually, the physician in China who initially sounded the alarm about coronavirus and was suppressed by the government, he was an ophthalmologist and he was thought to have contracted through his mucous membranes in his eyes. So having eye protection is also something that's really important. So if you can imagine a mic'd up, masked up, goggled up opera singer, that might be the optimal coronavirus singer, but it's a hard reality to imagine. Now, the other thing that I'll mention is that there are some other technologies that we use to decrease the risk of spread, and actually might have one around. So we use face shields in the hospital.
They just ask about face shields.
Yeah. So this goes around my forehead, and it's just a little piece of plastic there. You can see, but we'll put this on. This is supposed to serve as eye protection, but it comes down far enough that actually will block secretions from my mouth as well if I talk. That could potentially be a way to give yourself eye protection in addition to trying to decrease the spread through secretions coming out of your mouth. Again, it's something that's hard for me to imagine, a choir or a group of singers doing. But this is speaking from a scientific standpoint, decreasing the risk of spread in a high risk activity, which I would unfortunately put singing in that category, these are the kind of public health principles that we would want to adhere to minimize the risk of spread from a singer to another singer.
So again, speaking along this line of minimizing spread and risks, another conversation that I've heard is to take rehearsals and performances outdoors.
Mm-hmm.
You know, because one of the things, you know, I was thinking about as I was seeing theaters and removing the seating and everything, you know, I was like, well, what about, you know, the air conditioning systems and the vents? You know, I heard something about, you know, the particles traveling that way.
Mm-hmm.
And so I wonder, does it decrease impact if you move the rehearsals outside and you're practicing the distance, and you know you're outside in the open air? You know,
Yeah.
does that help?
Well, the benefit of being outside is that usually it's going to be easier to maintain distance and separation from others if you're not restricted by the physical limitations of a stage or a space. Granted, you're going to have some, you know, there's a stage area that's outside as well too that you want to adhere to, but generally it might be a little bit easier. You mentioned the air conditioning and circulating through vents, and there was an interesting case study out of China where they diagrammed 3 different tables with patrons sitting in the restaurant. And one of them, who was symptomatic, was sitting close to an air conditioning unit. And they showed that even outside that 6 feet range, people were getting infected outside of that range. And the thought was that the air conditioning kind of carried a current and helped spread those particles from the symptomatic person. So there is some credence to thinking that being outside might decrease that risk. And we're seeing that in the form of some gyms are doing outdoor classes and things like that. The thing I would add is when you're outside, there are also air currents. A breeze can come, and that can help the virus spread along a particle, especially if it's an aerosolized particle that can travel in the air a longer distance than the normal size droplet coming out of your mouth. You know, so it is thought to lower the risk, and because of the spatial ability, just doesn't lower it to zero. And that risk is still there. Some of those factors that you're escaping might still pop up. So a breeze comes and travels down, the person down from you might potentially, become infected. So one piece of advice I saw was for runners thinking about this. So if you're running and breathing heavily, is it more of a risk for people that are around you, even if they're outside of that 6 foot range? And the advice given was when you're passing someone close by and you're running, to have a mask on. You don't have to have it on your face the whole time, because that is hard. But put it up when you're coming past someone, and then you can take it back down to kind of minimize that spread. Obviously, if you're trying to sing and don't have a mask on, you can't do that. But that's just to show that being outside is thought to lower that risk, but not to zero.
I mean, and it just I guess a general statement of observation is just really the only 100% safe way is to be at home, right? And so now, as we're talking about returning to singing again, we're just looking at reducing risks. And so, one of the questions that a choral director might wonder is, should we encourage our 65 and older choir members to, sit out rehearsals, or, possibly, stagger, come every other week, or, is there a rotation for those who might be in a more at-risk category that would help to reduce the risks even more for them?
Yeah, I have some difficulty saying that one particular group is going to be higher risk than another. Just because, what I'm seeing in the ICU here are plenty of people that are in their 30s, 40s, 50s who are very sick. And on a percentage basis, the older you are, the more likely you are to end up in the hospital with COVID, and the more likely you are to have a bad outcome. But there are still a lot of young people who have gotten sick from this, and some of it might be related to socioeconomic factors. Some we think are related to the amount of exposure that you've had. So it's hard for me to say that a younger person would be fine, while an older person would not be. Statistically, that probably is true. But it's not going to matter for the young person who gets sick and contracts it, or the young person who comes to practice, contracts it, and then transmits it to their older relative who's at home. We all have our different sort of living situations. So, the thing about coronavirus that is challenge us to think not just about ourselves, but to think about those around us. And sometimes, like my wife and I, we make a decision not to have our grandparents come down to visit the kids. They're healthy, but they're older in age. And despite the fact that our kids miss them, we miss them, they're a big support for us. We used to live with them for 2 years. It's a safer decision to keep them away from the house, especially while I'm working in the hospital and around COVID patients. So it is difficult for me to say that, having a rotation where we're kind of leaving the older people in the course out is a safe way to go, because I still worry that there might be some young people who would still get sick. This is like the third thing I'm going to say that you're not going to like, but okay, I really enjoyed the trend of moving these performances to a electronic platform. These Zoom performances have been really interesting to see. One thing that, and Kristen's done a couple of videos now too, actually. But one thing I've noticed is that, in a way, and this is just me observing as a consumer of classical music and other forms of performance, it allows you to connect with the performer in a way that you couldn't really before. And just seeing someone in their usual setting much closer without the distance that you see on the stage and the lights and everything, you kind of seem like a superhuman up there. I remember seeing you in The Sound of Music, the opening scenes, you kind of seem like this superwoman, and someone who you couldn't relate to because you had no sort of link to that awesomeness that you were witnessing. You just felt like, this is great, it's unattainable, and I don't know who that kind of person is. When we're seeing, and I've seen a couple of vocalists now perform over Zoom, it seems like it's a much more intimate thing. And in one of the conversations leading into the coronavirus was, now that, the Mets closed down and Tanglewood's closed down, but they had dwindling audiences coming into this. And I wonder if some of that might have been the fact that, we have different ways of connecting with one another now. They're more intimate. And the notion of going to a concert hall and seeing a performance is in some ways becoming less in vogue now because of the lack of that human-to-human connection that you might have. But I've seen now vocalists are getting a little more notoriety and followings, and people who I'm pretty sure would not buy a ticket and go to a performance, but are nevertheless tapping into this genre and seeing someone perform. It's been really remarkable to see. And one of the things I talk about when I forecast forward is, don't be limited by what you've done to determine what you do going forward. And
you better preach.
And now that we've been forced to move inside and do things that we don't normally do, this is a moment to find a different way to connect with audiences. And this could potentially be a saving grace for an industry that had some difficulties in getting younger audiences to come in. So it's just something I'm also trying to like put some sort of positive on this.
I appreciate that. I appreciate that.
It's like I've just been giving you like bad news after bad news after bad news. But I do think that there's a good opportunity to connect with audiences in a different way here and grow the pile so that when it is safe to come back, there's so many other people who have tapped into choral singing and classical singing and all the different genres that your audience represents. We might be that much better coming out of it.
It's interesting because that is a whole nother conversation. Being engaged within and without the community. We had that conversation. Everyone is being required to pivot and to learn new things. And how fitting that creators are being called to create new ways to create. And it would be very, very hard to and this might be a lot of the struggle to imagine completely doing away with. It's one thing to pivot and to, add new ways, but it would be really, and I don't know that that's the ultimate story, right? But, it might be what is necessary until we get to what you spoke to before. And that's it, vaccines and cures. We have a question. Could you please explain the idea of testing positive for antibodies? Does that mean a person already had it and didn't know?
Right. So this is also a very difficult concept to explain. But the tests actually, we take a test and we tend to think that the test gives us the truth. And you hear I have a positive or a negative, and that means that I either have the disease or I don't have the disease, when in reality, it's not quite that simple. The test gives us a test result, and we have to use that result to try to interpret what the truth is. So, and a lot of that depends on how prevalent what you're looking for is around you. So there was an article in CNN I saw maybe last week that said that half of these antibody tests can be wrong, and say that you have had exposure to COVID even if you didn't, and you might think that you have immunity from that. And it gets into this really complicated concept of pre-test probability, which we're not going to talk about that. But I'll give you an example. So if my son is really into safaris nowadays, and every time I come home, there's a different sort of animal he's pretending to be. So one day he was an elephant, and we watched this really cute Meghan Markle narrated elephant documentary, and he was being an elephant for days in a row. But not a tangent, but pretend that I played for you the sound of an elephant trumpeting. So we all know what that sound sort of sounds like. And if I played it for you over video here, I'm pretty sure that you would know that it's an elephant. So that's the test. The test is your ability to determine what that sound is and identify the animal. And I think that, Jamie, you and anyone else listening would have near 100% accuracy in determining that that sound is an actual elephant. Now, the truth that we're trying to determine is, well, what does that sound mean? So if I tried to tell you, if you hear that sound, does that mean that there's an actual elephant somewhere close to you? That's going to depend on where you are. So if we were in Kenya or South Africa on a safari and we hear that sound, we're going to pull the camera and try to find out where that elephant is. Where is it? But what if we're on the streets of Boston or walking down, walking in a park somewhere in the United States, and we hear that same sound, same exact sound, same exact test, but it's a different interpretation now. It's much less likely that there's going to be an elephant walking down Central Park, for instance. It's just, they're not very prevalent there. So we hear that sound and we're not going to expect that there's an elephant there. So the challenge with a test, especially if it's in an area where there's lower prevalence, so there's not as many elephants in the area, you have to have a almost perfect test in order to tell you, have you actually had exposure to the virus or not? And the problem is a lot of these tests aren't close to perfect. They're good. They're 95%, which we would think that's pretty good. But actually, when you deploy it in somewhere where there's not a whole lot of people who've had disease, that makes it really hard, because you can either be a positive because it's a true positive, meaning that you had exposure to it, but there would also be false positives. The test is not perfect, so it's going to toss up some people who it says are positive, even though they have not had exposure to it. But you don't get the truth. All you get is that test result. So if you get a positive test result, you need to know, well, how likely am I to have been a true positive, or how likely is it that I'm a false positive and the test just, had a blip and I was caught up in that. And that's difficult to determine. And that's why when you're looking at an antibody test, you should make sure that it's FDA approved. And they have a website where they list the different testing platforms and what these different numbers are. So that concept of, if you hear an elephant sound, does it actually mean there's an elephant? That's called a positive predictive value, meaning that if you test positive for these antibodies, what is then your likelihood that you actually have had exposure to the virus or not? Because you can't just look at that result and say, oh, I'm good. You have to look at the overall prevalence in your community. So those numbers are all published for these different testing platforms on the FDA. So you can know, if I get a positive result from this, I'm 95% likely to have had positive because I actually had COVID and therefore may have a degree of protection or immunity.
And that's really what people are often looking for when they're taking these antibody tests, right? To see if they have any semblance of immunity. And is that a reasonable expectation that if you have had COVID or exposure, that you do have some degree of immunity?
Right. So, and that's another jump that we don't know the answer to yet. What I will say is that knowing from our experience with other respiratory viruses and other coronaviruses, having had exposure to it will usually give you a degree of immunity. The one thing I will say is that everyone's immune response is kind of like a fingerprint. It's relatively unique. So if two people get COVID, the antibodies, which are these proteins that helps your body fight the disease the next time you get it, between two people are going to be slightly different. So it's always possible that someone mounts a response, but that response may not be the best response and it may not be adequate. Whereas someone else might have a different response. And even if their antibody levels aren't as high, those antibodies that they made are more targeted and can work better. So every immune response is going to be unique. So we don't know what that absolute number is, but most of us assume, including myself, we assume that if you've been exposed to the virus, that you do have some measure of immunity. How long that lasts is difficult to say. We know in the case of influenza, that protection wanes over the course of the year, but we don't know in the case of COVID-19 what that looks like. This is something that we'll learn more about, for instance, with vaccine trials and in the studies that we're doing of plasma from people who have been infected, and we're giving transfusion of their antibodies to other patients to learn what's the protective effect from it. So we'll learn about more of that in the coming weeks and months.
So you mentioned resources. I mean, an hour goes by really fast.
I know.
It goes by really fast. We have like 5 minutes. So I'm going to ask, you talk about, you shared a resource with us, and we talked earlier about how there's so much information coming at us. Can you provide us with some sources, some resources where, where you feel like, these are trustworthy, science-based, tried and true voices that you can listen to and follow for guidance? Can you tell us some of those places to look?
Sure. So I do think that the CDC's COVID-19 resource is something. It's a good resource, and I've been using that. They've been recently publishing guidance on specific industries. Your state Department of Health is also likely to be a good resource for information. My state in Virginia has a lot of resources related to COVID-19 and gives you a little bit more information on the on at a more local level about what's going on in your community and what the recent guidance has been around reopenings and schools and things like that. Outside of that, I pointed people to the Truth or Fiction podcast from Sanjay Gupta on CNN. They've covered different topics related to COVID-19. So initially, the pathogenesis or how the virus actually spreads, and now it's moving into these questions that we're talking about now, more in the context of how do we reopen the economy. And then your usual news resources, CNN, Washington Post, health section. These are usually written by people who are in the know and know what they're talking about. Specific reporters on health affairs. Sarah Cliff is someone that I follow. She used to work for Fox News and now works for CNN. Scott Gottlieb, who's a former FDA commissioner. If you're interested in vaccine news, he's been working a lot on the fronts there. He I think he owns a company that's working on vaccine development. So I've looked at him as a source of information. And then past that, be careful and make sure that you're not getting so-called fake news, because I think when there's a lot of fear in the atmosphere, people who are not giving good information can get a platform. So there are a couple of people who are, for instance, anti-vaccine folks who, we're not going to get into that, but I'm an infectious disease doctor, and that seems anathema to me. But conspiracy theories that have come out around COVID-19 and did it start in a lab, and is the vaccine like a hidden sort of thing? Those are unfortunately gaining some traction, and we need to make sure that we combat that by getting good information. Lastly, not to plug myself, but every Monday at 7 p.m., I log on with Dr. Webb, who's a congressional candidate for the Virginia 5th District. And we talk about any questions that are on people's minds. So you can log in on there, 7 p.m. Eastern Standard Time. You can send us questions beforehand and we can answer them. But we tried to serve that role to kind of filter all the noise and give you the true signal.
Well, I'm glad you plugged yourself, because I was finna do it, because I just was not able to get. There are so many questions. But hopefully, this has served. It's definitely given me a lot of context, and some valuable information. And so I hope for the people who have watched, the singers, the choir directors, I hope that you've gotten, just a bit of something from this as you are looking at your way forward. Dr. Bell, what would you say would be a takeaway for us singers and choral directors?
Yeah, my takeaway is that I think the world is still very different than where it used to be. I think when it comes to singing, there's still some hurdles we have to clear in order to make it safe to go back to our usual activity. I do have hope that we'll have a vaccine by the late fall or the winter time, and it looks like we're on pace for that. We have to make sure that we still make some milestones there, but that will be the ultimate safe way to reopen once we have relative assurance that people, whether they are asymptomatic or not, or been exposed or not, will have some protection. So then I think we're doing some specific things to try to decrease the risk, both with patrons and on the performance side. And there are lots of different ways to skin that cat. But my message has been to try to embrace some of that change and find new ways to be creative. You're created by nature. This is another challenge in creativity, and the singing community can certainly do it. And I'm certainly rooting for you because, it runs my household as well.
I hear, be not weary in well doing. We're still in it. So thank you. I hear, be not weary in well doing. All right, let's see. We're still in it. Okay, so can you hear me? Thank you.
Yep.
Okay. All right, cool. All right. So thank you again. Like I said, I might be back to you with some more questions, but so I appreciate you having made yourself so available to us. So enjoy the rest of your day. Be well. Take care. Until next time, y'all watch Monday evenings at 7 p.m. All right. Bye.